Hi guys, my name's Emily Simon and my presentation's on anger management. So let's just jump into the definition first off. Anger is a range of emotional affective states of varying intensity from aggression and annoyance to rage and fury. It is also a strong, uncomfortable emotional reaction to another person or event that offends our beliefs about the way things should be in a particular situation. Defenbacher, a psychologist who has spent his career studying anger, he went a step further to argue that anger is interactional. He viewed anger as arising from interactions among, first off, one or more eliciting external events, also the individual's pre-anger state, including both momentary and enduring characteristics, such as anger-related memories and images, and then lastly, the person's appraisals, not only of eliciting events, but also of his or her coping resources, whether they were primary or secondary appraisals. Many people believe that controlling anger and impulse is perhaps one of the most difficult tasks of emotional literacy. Another definition about anger is likely when individuals assess themselves experiencing something that they should not have experienced, and with which they are unable to cope, or should not have to cope, and or for which they believe an attack of aggression is appropriate. So these are just some typical irrational beliefs that provoke anger when reality is different from what people believe that it should be. First off, people might believe that things should be quick and easy, or people should love and approve of them automatically. They believe that it's other people's fault and that other people make them angry, that they must have certainty always in their life, that they must do well in everything that they try, and that I must seek revenge for past items. So these are different reasons that people tend to get angry. There's a difference in anger between men and women. As reported by Thomas in 2003, men are usually more angered by a loss of control, inefficiency of the system, or a lack of staff professionalism. And so they may benefit more from anger management programs that focus and involve cognitive behavioral training and rational emotive therapy, while women are usually more angered and hurt when they perceive staff as uncaring and are unwilling to take time to listen to them and to form a relationship. They tend to benefit more from anger expressive training involving skill development that helps them eradicate their sense of powerlessness. It's also mentioned that anger is a normal, natural, and universal emotion. There are sometimes some benefits of anger, like it can lead a person to situational insight. It grabs other people's attention because it is an unmistakably clear form of communication. It protects against domination, control, or being taken advantage of. It serves as a warning signal that one's stressors are exceeding one's resources. And there's also more benefits. But overall, anger has many drawbacks too. Anger increases people's heart rate, blood pressure, their energy hormones, adrenaline, and noradrenaline. It increases stomach acid secretions, and it weakens someone's immune system. So initially, this is okay. It's kind of our fight back response in the body. So in short term, it's beneficial, but over a long term of time, it is not beneficial. Some other drawbacks to anger are more psychological rather than physical. The APA in 2006 stated that individuals consciously and unconsciously use three main approaches when dealing with anger. First off is expressing. People who do not control how they express their anger may do so in ways that produce harmful results, ranging from conviction and incarceration to being labeled as socially inept and isolative. These individuals may also exhibit aggression, or passive-aggressive behaviors such as being cynical or hostile or critical of others. The second main approach is suppressing. Suppressing anger happens when the individual holds on to his or her anger and tries to concentrate on something positive. While in many cases this approach works well, and others, when the anger festers inside the person, it often turns towards an inward destructive behavior. And lastly, the third main approach that most people use is a calming technique. So some of these calming techniques include relaxation, cognitive restructuring, problem solving, avoidance, counseling, assertiveness training, etc. And we'll talk about more of them in a little bit. So it's noted that, especially for individuals with long-term aggression issues, such as those with persistent mental illness, the etiology is multifaceted, so treatment must be multifaceted as well, often including both pharmacological and behavioral treatments. They also noted that anger management treatment often includes training in problem-solving, social skills, relaxation, and cognitive behavioral therapy. He noted that mindfulness therapy, awareness, and non-judgmental acceptance with a clear and calm and focusing on the present moment is often added to cognitive behavioral therapy and seen beneficial in these type of clients. The two productive anger management techniques that are supported by research is first taking constructive action on the precursors to anger whenever possible. But when no constructive action is possible, which it is in many situations, you can't control everything, finding healthy ways to discharge the strong psychological arousal of anger through exercise, laughter, or calming techniques such as meditation or talking with a good friend is really beneficial. And we'll talk about more a little bit later. So some of the client groups that you might be working with that have anger issues are at-risk youth, youth with Asperger's syndrome, adult offenders, individuals with cognitive communication disabilities, individuals, especially in the armed forces who have PTSD, tend to have anger issues, adults with mildly intellectual disability, adults with developmental disability, people with acquired brain injuries, or mental health problems, especially those with depression. So I think any kind of client in any field you're working as a CTRS, you're going to deal with people with anger issues. Anger is a very common emotion among all of us. So I did some research online, and these are just some techniques that I found that can be really beneficial when treating clients that have anger management problems. So meditation is a huge one. So there's a link I posted below it that goes into further. You can read the article and the research done on meditation. The next is a 7-step anger management program for children with attention deficit or hyperactivity disorder. And this was actually created by a CTRS. So if you guys want to click the link below, there's a lot of good information. And it's really applicable to us in our field as CTRSs. These are a couple examples of techniques that I found in the text. The first one is for individuals with disabilities, and the next one is for people with developmental disabilities. So you can go into the textbook Facilitation of Therapeutic Recreation Services by Stumble and Wardlaw and look about page 175 to 180, and they provide a ton of different techniques and different programs you can use. So last but not least, how does this apply to TR? We've talked about it a little bit throughout the presentation, but the CTRS is going to work with a number of clients that have different ranges of anger issues. So no matter really who you work with, you're going to have to use some of these techniques during your practice. Anger management is also one of the main complementary skills and sets targeted during leisure education programs. So it's a main part of TR. On page 183 of the text, Gongora has an 8-session anger coping program that is to be implemented by a CTRS. So if you guys want to look on that page of the text, it goes into further detail of the 8 stages that are very beneficial for multiple clients. And then lastly, although there is not a huge amount of research on anger management in TR, when I looked it up, and I also mentioned that in the text, the studies that have been done are very promising. And so I think that as CTRSs, we learn a lot about anger management techniques and follow the tips that are provided in the text and provided in studies that we can find online. We can work well together and help our clients get over anger management issues. And thank you for your time listening, guys.